everybody. Welcome to Outdoor Women's Wellness First Live podcast. Today, we're here with Malerie Kurt. Mal is a great friend of mine and an amazing PT as well. And we're going to talk to you guys a little bit about pelvic floor and what that means in terms of just the pelvic floor and physical therapy. So I'll let Mal introduce herself a little bit. Mal.
Hi, I'm Mal. I like Zoe too, just to put that out there. Yeah, I have been a pelvic health therapist for coming up on like 2 years now, two and a half. And I always say, if you asked me if I would do this in, school, I would have said absolutely not my cup of tea. But actually, once I got into it, I just fell in love with it. I feel like it's a very underserved realm of PT, so I think it's good to get the word out there.
I fully agree. So I live in a very rural area, and being in a rural area, you see everything. You don't get a choice on what you want to see. You just see a little bit of it all. So I'm actually working with pelvic floor patients as well. And so we're going to just give you guys a little intro to pelvic floor. So Mal, do you want to talk about the pelvic floor to start? Like just
sure.
What it is?
Yeah, because I feel like people don't know, right? Like when you hear pelvic floor, you think like obviously pelvis right away. You're like, okay, kind of in the realm, but people don't know they have muscles in between their hip bones. Like you think of like your quads and your glutes and like all those things that they're trying to help you train in the gym, right? Like between and inside of your pelvis, there's muscles, and they're super important. If they're not working well, or if your nervous system isn't speaking to those muscles well, then things can happen. And that's where PT comes in, because that's our big thing, right, is neuromusculoskeletal dysfunction. So that's all of these things that we're talking about.
Mm-hmm.
Yeah.
And so for our viewers too, so the pelvic floor is, so in between your two butt bones, your sit bones, and then between your coccyx, so your tailbone, and your pubic bone, so the bone in the front. All of that area makes up your pelvic floor, and it holds basically everything in, so we don't just kind of fall off the bottom.
Right.
It's supporting all of our organs and our bladder and all of those good things, and it is super important. And it is not just about Kegels to strengthen it.
Right. I've heard so many people say like, oh, well, my doctor told me to do Kegels and it'll get better. And I think that's not really always the case. I've met people who are super, super strong in their pelvic floor, and those muscles are active, but they have all these issues because they're too strong or because their muscles aren't firing at the right time. So I like to help people figure that out. But there's so much more than just even knowing about the pelvic floor or like being aware of how to really work those muscles. It's also about the kinds of habits that we build around going to the bathroom. And like people, I think, take that for granted. When you're a kid, you get potty trained and you're like, oh, yep, I'm good. I know what to do now.
I know how to use
but I do it every day. I mean, hopefully you do it every day. But I think when we break down your habits and what you're doing regarding like hydration, regarding exercise, regarding stretching, breathing, how you breathe plays into it. Like there's just so many things that you can focus on and make things better if you have any of the pelvic floor dysfunctions that can arise.
Yeah, and that kind of brings us into the next thing is common pelvic floor dysfunction. So we're not getting into all of the different areas of pelvic floor dysfunction and treatment. We do have a webinar that goes into a lot more detail with Mal on our website. If anyone's interested, then there'll be a link to it in the clip notes of this. But a little bit of an intro into pelvic floor dysfunction. So what that means, pain is one thing, and we associate pain with dysfunction quite often, having just pelvic pain. But pain is not where it starts or ends. There's a lot more to that. And so we can look at bladder dysfunction, and sometimes if we are leaking or having a hard time using the bathroom, not able to fully empty, those can be all signs of pelvic floor dysfunction. And postpartum, right? A lot of stuff happens down there when you have a baby, or even when you're in pregnancy. I mean, there's a lot of extra weight that's weighing down on your pelvic floor. Mal, do you have any more to add to those?
If you ever like get a chance, if you're in like your gynecologist's office, or like if you're nearby a muscle poster somewhere, who knows, take a look at, if you can, where the bladder and the uterus sit. It's like literally your uterus sits on top of your bladder. Like, who engineered this? Who decided that that was how that was going to get set up? But anyway, you can imagine during pregnancy that there's a lot of strain, right? And so you talked about like incontinence, like bladder leaking. There's two ways that can happen, right? You can have urge incontinence, which has a lot to do with your habits around the bathroom that we were talking about. Like if you rush to the bathroom every time you have to go, or if you just in case pee, or if you hover over public toilet seats. Please stop, ladies. I tell it to everyone I know. Don't hover. But you can also
lay
have
down
stress
a
incontinence.
sanitary wipe if you need to, or one of the coverings, or
like you have to sit. Honestly, your phone's dirtier. Come on. But otherwise, you can have stress incontinence, and that's more where the muscles aren't responding either quickly enough or strongly enough to hold things back. So there's so much we can do. People don't know.
So bathrooming, and then sometimes even just pain, like having pelvic pain. So that can be, you can feel the pain in other areas, even when experiencing pelvic pain. Sometimes low back pain or hip pain can be signs of pelvic pain, just misdiagnosed.
Right. Like ladies, some of you may have like a symptom when you're having cramps, your back kills, like your low back. And that has to do literally with the muscles around your uterus, and your uterus is a muscle. If those muscles are tight and irritated, then you're going to feel it somewhere else. And so I think it's helpful to know that your pain, like let's say you've been working on it forever and ever and it's not getting better, or it's something new and you just can't quite put a finger on it, that's something that can be helped with pelvic PT, especially in person. So I think usually, like we talked a little bit about how like we see all kinds of people. I think there's a realm for just talking about it, and then there's a realm for treating it directly. And that's where it gets a little bit more, I don't know, like sensitive, I guess. Like people are a little hesitant about pelvic floor PT because that can be a part of it. But I've worked with plenty of people where we kind of ease into the idea of maybe doing something like that down the road, and people do get better. So even if people are willing to just listen or like learn from our webinar, or if they have a consult with one of us, like that would be probably really helpful just to get you on the right path.
Yeah. So let's talk a little bit about what pelvic floor PT is and the different avenues of it. So if you want to go to PT for pelvic floor, you want to find a therapist that is certified in pelvic floor or is knowledgeable in pelvic floor, has experience with it. Depending on the state you live in, sometimes you can go directly to the therapist. You don't need to see your doctor first. Other states, and if you have questions, we're happy to help you. But in other states, you have direct access. So for example, the states that I am licensed in, I'm licensed in California, Nevada, and Washington, where all three have direct access. So I could work with you immediately without having a doctor's note. And then Mal, is Wisconsin, I believe, is also direct access. Is that right?
Yeah, we have direct access. I'm about to submit everything to become a direct access provider. So that's exciting because we've been fighting for that at my little tiny rural hospital for probably 2 years. We've been talking about it. So it's exciting to see. Yeah.
Awesome.
Yeah.
And like I said, if you're not in one of these 4 states, I'm happy to help and help find you a provider in your area. For working with us, you can work with pelvic floor virtually, so doing telehealth PT, where it'd be a conversation, kind of like what Mal and I are doing right now, but a little bit more in-depth and based on you. And we would talk about what you're having, have you fill out a bladder diary, and a lot of different educational pieces that are directly related to you, your health history, and your current experience. Another option is to go into an office for pelvic floor physical therapy. And that can entail both external physical therapy, so just working when you're clothed, outside your clothes, looking at muscle strength. And there's also therapists that are certified for, or that are trained in internal physical therapy. And I'm going to have Mal talk a little bit more about that.
Yeah, sure. So like Zoe said, the beginning of our session, or even the first couple sessions, is usually just a lot of talking, getting to know what your problems are, what your goals are, what other things can we immediately start working on, for a home program, what can you start affecting? And then a lot of people, they'll either ask to wait for another session, or they'll just be like, let's just do it. Like, I've met a ton of people who are so comfortable. So usually what I do, I explain the whole thing, kind of like I'm doing now. I explain the whole symptom, or the whole, process. I do an external visual exam first. I have you take off your bottoms. You can leave your socks on if that's more comfortable for you. And then I always step out, and then I'll step back in. You've got a blanket over you. And then we sort of check it out. I just look, I see what's going on. I ask people to cough, to bear down, to do what they understand as a Kegel. And so often immediately I can start having a teaching moment, right? Like, I can help people just like, oh, well, actually you're bearing down right now. Or if I ask people to bear down and they squeeze again, like, that tells me a lot about the coordination of their muscles. So right away, just by observing what those muscles can do, I can start to create a plan. If people are still comfortable, then I'll do an external exam. And oftentimes with like bladder, it depends on everyone. Oftentimes the external exam, everything feels pretty fine. Maybe I'll find some tight muscles. I always tell people we're in a clockwise formation. I feel each of the outer layers of the muscles of the pelvic floor. And then if we find anything, we'll treat it. If not, we keep going. Then I actually do an internal exam, as long as the person's okay with it. We talk about consent. I always offer to have another person in the room if that makes you more comfortable. Bring your mom, your sister, your husband, your whoever you like. Then we'll do an internal exam. And that involves one glove finger. We use lubrication. Mine's called Slippery Stuff. I just think that's the cutest thing ever. And I'll feel up to my first knuckle. I'll have you squeeze, push me out, bear down. I want to see what those muscles are doing to my finger, because that's how I grade it. That's how we're trained to grade the muscles. After layer 1, we'll go to layer 2. That's my second knuckle. I can kind of feel everything squeeze. If you are able to squeeze and lift up and in, then I'm like thrilled. Like, that's amazing. Lots of people, I'll get like, they'll squeeze, but nothing will really go anywhere, or they'll even push me out. And we do that for the third layer too. So I also check for pain, trigger points. If there's any areas like, oh, that's really tender, or sometimes right away I can actually get muscles to release. Especially like my people who've been struggling with constipation for a long time. If I release one of the muscles that connect towards their tailbone and sort of around that area, they'll call me the next day. I had a guy call me on my birthday last year, go, I just pooped for the first time in 9 months. I'm so happy. Like, and it was a great birthday present. So you know that I'm doing the right thing with my career, that I'm pumped about that. But like, there's right away in the moment when you're assessing, you can also be treating. And that's what I really like about the pelvic floor. And so often I'll treat people 2, 3, 4 times for internal, and then we don't do that anymore because their symptoms start to get better. We focus on the habits, we focus on biofeedback, which is an external way of knowing if your muscles are doing the right thing at the right time. And I combine that with running, jumping jacks, push-ups, core work. If people are leaking, they're doing core work, like, we can figure out in any position what's going on. So there's so much to be said about just what you can talk about with pelvic floor, but there's also such a big wide world of things that you can do in person. So I just love it. Sorry if I'm gushing.
It's awesome. And the best part is that your therapist is going to do what makes you feel comfortable. So if you're not comfortable with internal work, great. We're going to focus on external work. We're going to look at your hip, your core strength, and you can tell a lot even just externally. So whatever you're comfortable with, or if you'd rather just focus just on hips and see how your hips do and how that relates to your pelvic floor, we can do that too and work your way towards that, or just work in your comfort zone. And I think that's one of the best things about it, is it can be tailored to whatever you need, just with our guidance.
Yeah.
Anything else, Mal, that you want to add on today?
I just would like to really reiterate, please don't hover over public toilet seats. But other than that, I think we got it.
Cool. So if anyone is in the states of Wisconsin, Nevada, California, or Washington and wants to have a virtual pelvic floor evaluation, please contact Outdoor Women's Wellness, and the link will be below in the notes as well. And then if you like this and you want more information on the pelvic floor, where we go into more detail on the bladder diary, the 3 layers of the pelvic floor, what each of them are, and treatment techniques and tips that are just general, not for diagnostics, but it's $15. It's a recorded webinar that Mal did last month, and it is available on our website for purchase. So.
I will tell you, it is, I think, I spoke so quickly that you probably got at least $30 worth of information for $15.
It's a pretty good deal. Mal did a fabulous job, and happy to have her on board. All right, Mal, it's been great as always.
Yeah, always good to see you.
Talk to you soon. Bye, guys.
Bye.